Hello and welcome back to MediInsights, where we unlock the wonders of wellness. Today, we're diving into a critical topic that affects thousands of lives: brain tumors. Whether you're looking for answers about what a brain tumor is, the symptoms to watch out for, or how these tumors are treated, you've come to the right place. In this video, we'll break down everything you need to know, from the causes and diagnosis to life-saving treatments and essential advice for patients. Stay tuned as we navigate through this complex but vital subject, empowering you with the knowledge to face it head-on. Let's get started. A brain tumor is an abnormal growth of cells within the brain or the tissues surrounding it. Tumors can be classified as either benign or malignant. Brain tumors can originate from various cells and tissues within the brain, referred to as primary tumors, or they can spread from other parts of the body, known as secondary or metastatic tumors. Brain tumors fall under the categories of neurological diseases and oncological conditions when malignant. They can be further classified based on the type of cells involved or their behavior. Next, signs and symptoms of a brain tumor. The symptoms of a brain tumor vary depending on the tumor's size, location, and growth rate. Common signs and symptoms include persistent headaches, often worse in the morning or with movement, seizures, nausea, and vomiting, particularly in the morning, vision problems such as blurred or double vision, balance and coordination difficulties, cognitive changes like memory loss or confusion, speech difficulties, personality changes, and weakness or numbness in the limbs. Next, causes of a brain tumor. The exact cause of most brain tumors is unknown, but certain factors may increase the risk. Genetic mutations and inherited conditions such as neurofibromatosis and Li-Fraumeni syndrome can contribute to brain tumor development. Exposure to ionizing radiation, such as from radiation therapy, is another risk factor. Additionally, a family history of brain tumors and a weakened immune system, which increases the risk of lymphomas in the brain, are also associated with a higher likelihood of developing brain tumors. Next, diagnosis of a brain tumor. The diagnosis of a brain tumor typically involves several steps. A neurological examination assesses motor skills, balance, coordination, and reflexes. Imaging tests such as MRI, CT scans, and PET scans are used to detect and evaluate the tumor. A biopsy may be performed to determine whether the tumor is benign or malignant, and a spinal tap may be conducted if the cancer has spread to the brain from other parts of the body. The medical specialists involved in diagnosing and treating brain tumors include neurologists, neurosurgeons, oncologists, and radiologists. Next, treatment of a brain tumor. The treatment of a brain tumor depends on factors such as the tumor type, size, location, and the patient's overall health. Surgery is often the first step, aiming to remove as much of the tumor as possible. Radiation therapy, using high-energy beams like X-rays, is used to kill tumor cells. Chemotherapy involves using drugs to kill or slow the growth of cancer cells, with temozolomide being a commonly used drug for brain tumors. Targeted therapy drugs are designed to address specific abnormalities within cancer cells, and immunotherapy enhances the immune system's ability to fight the tumor. Stereotactic radiosurgery is a precise form of radiation therapy that targets the tumor without requiring an incision. Next, precautions for brain tumor patients. Brain tumor patients need regular monitoring through routine MRI or CT scans to track the tumor's size and response to treatment. Symptom management is essential, with medications and therapies addressing issues such as headaches and seizures. Patients should avoid unnecessary exposure to harmful radiation and make lifestyle adjustments to prevent injury, especially if balance or coordination is affected. Next, advice for brain tumor patients. Patients should follow their treatment plan closely and adhere to healthcare providers' recommendations. Managing stress through psychological support, relaxation techniques, and counseling is important for emotional well-being. Physical rehabilitation may be necessary to improve strength and mobility. Staying connected with family and friends provides emotional support, and joining brain tumor support groups can offer shared experiences and encouragement during treatment and recovery. By the end of this video, you'll have a solid understanding of brain tumor, its signs and symptoms, causes, diagnosis, treatments, precautions, and important advice for patients. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.